On today's episode, I am very excited to talk to you guys about Tirzepatide. Tirzepatide is officially approved for weight loss from the FDA, and I'm going to break down how I'm using it in my practice, the protocols, and another thing that we are going to dive deep into, which I am super pumped about, is the other benefits that GLP-1 agonists, which are Semaglutide and Tirzepatide, are having other than weight loss. Hi everyone, my name is Dr. Kristen Herzog. I am a board-certified nurse practitioner and injection specialist. On today's episode, I am very excited to talk to you guys about Tirzepatide. Tirzepatide is officially approved for weight loss from the FDA, so that is very exciting. In my opinion, Tirzepatide is Semaglutide 2.0. And I'm going to break down exactly why I feel this way, how I'm using it in my practice, the protocols, and another thing that we are going to dive deep into, which I am super pumped about, is the other benefits that GLP-1 agonists, which are Semaglutide and Tirzepatide, are having other than weight loss. Because all we are hearing in the media, on Instagram, TikTok, literally everywhere, is how Semaglutide and Tirzepatide are amazing for weight loss, how people are achieving their weight loss goals, they're getting skinny, they're feeling better, they're looking better. But we are discovering so many other benefits for GLP-1s, you guys. It is insane. So here we go. All right, so what is a GLP-1 agonist? I think we need to start there. For anyone not familiar with Semaglutide or Tirzepatide, they are FDA approved for diabetes. And now they are both FDA approved for weight loss. And what they do is they work on GLP-1 hormone receptors. So GLP-1 is a hormone that is secreted into your gut after you eat that stimulates the release of insulin. So that is going to break down sugar. It's going to keep the sugar in your bloodstream lower. So that is why originally they were FDA approved for diabetes. What we discovered though is because these medications break down insulin, they also keep food in your stomach longer. They delay gastric emptying and they increase the feeling of fullness. So what that means is because we are feeling full longer, we are eating less because the food in our stomach is not getting broken down as quickly as it is without these GLP-1 agonist medications. We are not only eating less, but we're making healthier choices because we're not going to eat something like bread that's going to sit in our stomach for a super long time and make us feel gross and horrible. Instead, we're going to be eating high protein, vegetables, foods that are fueling our body and making us not feel overly full. So these medications are freaking amazing. So what is the difference between Semaglutide and Tirzepatide, and why, in my opinion, is Tirzepatide 2.0? Well, Tirzepatide is going to work on not one hormone receptor, but two hormone receptors. So you are going to have a better secretion of insulin and increased feeling of fullness without the side effects. So I have converted 90% of my patients in my practice that are on Semaglutide to Tirzepatide. They are feeling amazing. They are getting better results. It is absolutely awesome. Now, because it does work faster and it also has less side effects, this drug is a little bit more expensive. So for some people, this may be a factor that contributes to them wanting to choose to be on Semaglutide over Tirzepatide. But for me, the increased price point and for most patients in my practice is well worth the less side effects and also well worth getting results faster. So it is something to consider. Okay, just because something has less side effects and has faster results does not mean that you can't put in the work. I am still doing the same protocols in my practice as I am with Semaglutide. So this medication still needs to be a tool in the toolbox. People are using this drug to lose a bunch of weight and not making the lifestyle changes. And therefore, as soon as they're off the drug, they are gaining the weight back and then they're getting right back on the drug. So it's important to understand that both of these drugs need to be monitored and they also need to be used appropriately. So I'm going to talk to you guys about my exact protocol. So in my practice, My protocol with tirzepatide and with semaglutide is to make sure my patients are eating a high protein diet. So what that looks like is starting your day with protein and ending your day with protein. 30 grams of protein per meal is the goal. So in the mornings, I encourage my patients to eat something like eggs with avocado and turkey bacon. For dinner, I encourage them to eat something like chicken with sweet potato, with vegetables, instead of focusing on what not to eat, because that can feel very restrictive. I encourage my patients to focus on what to eat, which is high protein. So every time you eat something, be sure that there is protein in it. And that is important because not only is it going to fuel your body, but it's also going to help make sure that you don't lose muscle, which is one of those unwanted side effects of tirzepatide and semaglutide. So we have to make sure that we are keeping our muscle. That is why my second protocol in my practice is to make sure all of my patients are lifting weights. So I was somebody that was a huge cardio bunny. I loved running. I hated lifting weights. I was afraid of feeling bulky. In the last year, my body has dramatically changed from lifting weights, so I highly recommend it, and I recommend it to my patients. I recommend that they do 3 to 4 days a week of strength training. Now, that doesn't mean you have to go do CrossFit or bench 150 pounds. I literally use like 10 to 15 pound dumbbells at my house when I do my workouts, and that's what I tell my patients to. As long as you are focusing on building muscle with high protein and strength training workouts, you are going to be successful on this drug. In addition to strength training and to eating high protein, we also need to make sure that we are controlling our portions. And so what that means is use this drug to your advantage. It makes you feel full longer. So eat smaller amounts of food. That way, when you are off the drug, you can continue eating small amounts of food and not gain the weight back. So that is all about tirzepatide, which is semaglutide 2.0 in my opinion. Works faster, less side effects. Patients can have a more manageable lifestyle on it because unlike semaglutide, you're not getting that ick feeling when you think of food. Instead, you're just eating less food and making smarter decisions. So I absolutely love tirzepatide. Make sure you go to a doctor that is trained with using this drug that can make sure that you are a candidate. Some things in my practice that I look for are your recent labs. I want to know your blood sugar. I want to know your thyroid levels, your cholesterol levels. I want to make sure that we do a complete blood panel and a complete metabolic panel just to make sure that you are a healthy candidate. Now, another protocol that I use in my practice is NAD. And I recently did an episode on NAD. You guys have to tune in. But this is a way that I am helping my patients maintain their weight loss after tirzepatide and transitioning them off of tirzepatide. So check out my episode on NAD. And now let's talk about the breakthrough treatments with GLP-1s. We talked about what they are, the difference between semaglutide and tirzepatide, why I prefer tirzepatide over Ozempic. And now I want to talk about the breakthrough treatments because we are discovering more benefits than just weight loss, you guys, and it is so cool. So part of the things that we are discovering are with patients with PCOS, they are having improved fertility. Now, PCOS is polycystic ovarian syndrome. Typically, patients with PCOS are insulin resistant. They have difficulty losing weight. They have irregular menstrual cycles, all of which can contribute to having fertility issues. Now, when they are on this drug, it is really cool because they are losing the weight, they are improving their insulin resistance, therefore their menstruation is becoming more regular, they are less insulin resistant, they're actually reversing insulin resistance, and there are some studies showing that patients on this drug have successfully gotten pregnant when they struggled with PCOS. So that is something really cool, and I'm so excited to continue to learn more about these breakthrough treatments. Another breakthrough treatment with GLPs is anti-inflammatory. So it's really cool because patients that suffer from inflammation are feeling better on this drug. And the reason I believe that they are feeling better on this drug is because using these medications can help improve leaky gut. So what is leaky gut? Leaky gut is when your gut is very permeable. So everything that you eat, including toxins, bad foods, sugars, all of these things are being released into your bloodstream. They contribute to bloating, they contribute to inflammation and just not feeling well, a variety of other issues. Leaky gut and gut health issues are at the core of most autoimmune diseases. Now, the research with this is somewhat controversial. There are some people that believe that yes, gut health is in fact related to autoimmune diseases. I am one of those people. So when I started thinking about GLP-1s and how they work and how they are keeping food in your stomach longer, how patients are able to eat less food and make healthier choices, I'm like, well, amazing. This is going to help heal leaky gut, because what do we do for leaky gut? We encourage a low FODMAP diet. They are going to be eating foods that are clean and nutritious with high fiber to heal leaky gut. We also encourage eating less frequently so that your stomach has time to rest and digest. So when we have this medication that keeps food in our stomach longer and we are making healthier choices, eating less sugar, less processed foods, less breads, less junk, we are going to heal leaky gut. So patients in my practice that are suffering from inflammation and autoimmune issues are feeling better on this drug, which is absolutely amazing. I have several patients in my practice that have thyroid issues, that suffered from insulin resistance, that suffered from rheumatoid arthritis, other inflammatory diseases. And I, of course, made sure first you get approval with your doctor. You have to understand this is not a curative treatment, okay? This is something that is going to help you feel better. It may or may not work. I cannot guarantee outcomes. I always explain that for my patient. And then first and foremost, they have to get approval with their doctor to make sure that Tirzepatide or Semaglutide are not going to have an impact on the current medications that they're taking, because this is an adjunct therapy, meaning you do it alongside those other treatments. But my patients are having extreme success. So it's super, super amazing. Another thing that they are finding, which I'm really excited to read more about, and I have to do more studies on this and read more studies on this before I give too much information, but there is some data out there that is showing that GLPs can also help improve cognitive diseases like dementia and Alzheimer's. There's a lot of research that talk about how Alzheimer's is the third diabetes, and that, the foods that we eat can contribute to cognitive impairment. So this is just really, really cool. I think the data is going to continue to trickle in. We are going to be learning more and more about these drugs. They're so new to the United States. People were using these for diabetes for quite some time, but the weight loss trend really just skyrocketed in 2023, and it's continuing to skyrocket. And I feel like the more we study these drugs, the more we learn about these drugs, the more benefits that we are going to see utilizing these peptides, right? These are peptides. So these are natural drugs and they are helping so many people. You have to think risks and benefits. So if you have high blood sugar, high cholesterol, well, being on this drug can help improve those cardiovascular risks and make you a more healthier person. So I'm excited. More things to come. Hopefully this episode was really interesting and you guys learned about the differences between semaglutide and tirzepatide. The biggest difference meaning that tirzepatide is going to work on 2 receptors, not just one. So it's going to work faster with less side effects, however, will be more expensive. And that GLPs are honestly having a more significant impact than just weight loss. So more to come on that. Thanks for tuning in to today's episode. I'm your host, Dr. Kristen Herzog. I will see you guys next week. Follow me on Instagram at The Perfect Dose.